An estimation of 13,000 people per year are diagnosed with cancer in Malawi, while cervical cancer alone kills about 1,500 women a year here in Malawi. And 10,300 of the 13,000 cancer patients are mostly admitted in public hospitals here in Malawi. This is Agnes Sawali. She started experiencing abdominal pains and visited a hospital near her home in Machinjiri for treatment. She later started having smelly discharges from her private parts. The health workers continued giving her painkillers without considering the signs of cervical cancer which she was presenting to them. 2 years later, she was diagnosed with cervical cancer at Queen Elizabeth Central Hospital, but doctors told her that it was late and that her case had worsened. They told her that she needed radiotherapy, a service not available in Malawi. It can be accessed at least in South Africa. But Agnes has no money and no one to help her get the treatment. So in the meantime, she's here waiting and hoping. Late diagnosis is one of the major factors hastening death in cancer patients in Malawi. Not all health workers have the knowledge on cancers, putting at risk lives of many who otherwise would have been cured if their problems were detected at an early stage. Laisani Eliasi is another cancer patient. He is 31 years old. Another person who was diagnosed late. He says his situation could have been different if he was given the required information and advice earlier. Now he has to go through chemotherapy and keep his living days longer. Although late diagnosis is one of the biggest predicaments due to lack of information and expertise amongst health workers, some cancer patients have been left to die due to lack of services that would lead into early cancer diagnosis. This is the plight of cancer patients in Malawi. Most of them pass through hell trying to hold on to life. Without equipment, there is nothing much that this oncologist, Leo Masamba, can do.
Oftentimes, when patients go to health centers, you'll find that people do not fully, recognize cancer in its early stages. There have been women, for instance, who have been told that they have sexually transmitted diseases, when in fact maybe they have cervical cancer. There are issues that can explain this. One of them is maybe failure of the system to retrain people that are working in peripheral or smaller health units to make them understand on early signs and symptoms of cancer.
Dr. Masamba says although the country has made strides in some areas through well-wishers, crucial parts in the oncology department have not been made. Lack of admission space, occasional shortage of drugs, and lack of equipment is the greatest setback. Sounding frustrated, he told this reporter that the whole Queen Elizabeth Central Hospital has no CT scanning machine, which is a necessity.
The CT scan at Queen's, yes, it's true. The building is, I understand, is finished now. But the CT scan, of course, has been lying somewhere for years now. It has been so slow, to get this building done. I don't know, I don't do buildings, but the people in building may answer this better. It's so painful for the patients because we can't offer them proper, service because we don't have a working CT scan for a big hospital like Queen's. This is a shame, to be honest with you. A big hospital like Queen's not have a CT scan, or sometimes you find, let's say, CT scan in Kamuzu, but when it breaks down, it cannot be repaired in time. All these things seriously, affect delivery of care.
According to Dr. Masamba, the CT scan house construction started some time back, but now it stands abandoned, while the CT scan, which was procured 2 years ago, lies idle somewhere in Lilongwe. Government with other stakeholders managed to construct new wards which remain unoccupied and somehow unfinished. The Minister of Health says he is aware of the challenges, but government will make sure that the new cancer wards are finished on time. The minister mentioned that this year, Malawi will be able to offer radiotherapy services.
As Malawi, we have wanted to have our own radiotherapy treatment center in Malawi. And since I became minister, I've been pushing for the construction of the cancer center here in Lilongwe. And as I said at the beginning, we have awarded the contracts to the construction of the cancer center in Lilongwe. That cancer center will basically provide radiotherapy services. So for people that need treatment on breast cancer or cervical cancer, and of course the other cancers that need radiotherapy, we will not need to send people abroad. I think the actual brickwork is starting on the 28th of February. From that day onwards, we can count about 82 weeks, and then the cancer center will be open.
For Lyson Elias, he has now resorted to finding solace in the Word of God. Reading the Chipangano Jatsopano Bible version, he says he's preparing himself for a better life in heaven. It's this hopelessness that worries both the patients and medical staff treating them. Winnie Botha, MBC News, Blantyre.